Hi, I'm Don Barnes. I was first diagnosed with diabetes in summer of 2005 at the age of 55. It was discovered by my late wife, who saw me shaking and decided to give me a blood test at home, and my blood sugar read 330. Before that, I kind of suspected that I might be a diabetic or pre-diabetic because I had gained a lot of weight, and at the time I weighed about 270 pounds. I started shopping for a health club. I went to 4 different health clubs before I wound up at the Central YMCA, and I'm so glad that I did, because when I was introduced to the trainer at the Central YMCA, she was the first person that asked me what I was looking for health-wise out of a training program, not strength-wise, not building my body. What am I here for specifically? When I told her that I was here for cardio mainly, and that everything else would be an add-on, she said to me, before I'm going to do anything with you, I'm going to call your cardiologist and get permission to set up a program and make sure that you're healthy enough to do it. No one else other than the Central YMCA had done that, and for that I'm going to be eternally grateful. I started in January. In January I weighed 233 pounds. Today I weigh 208 pounds. So I've lost 25 pounds since January. I've lost 2 pant sizes. I've lost a complete shirt size, and I'm an entirely different person than what I was health-wise. I went and saw my cardiologist about 6 weeks ago. He almost didn't recognize me. I also went to my endocrinologist. My endocrinologist took me off of virtually every medicine that I've been on for adult onset diabetes and looked at me and said, basically, you're not a diabetic anymore. You've done that well. Now, she's not going to let me go. I'm going to see her every 6 months just to make sure. But the Y program really turned my life around.
Hi, my name is Kim Guerin Hudson, and I am a family physician for the Cleveland Clinic, South Russell Family Medicine Center. I am a Lake County resident and have been a member of the YMCA for 25 years now. I have been asked today to talk a little bit about diabetes and why it's so important to the community and why prevention is where the YMCA is really helping out. Diabetes is incredibly common. 30 million Americans have diabetes, and they figure only 3/4 of people know that they have diabetes. When people have diabetes, all that sugar that floats around in your bloodstream creates problems. It can damage blood vessels, nerve cells, and lead to debilitating things like strokes, heart attacks, blindness, kidney failure, and numbness in your fingers and toes. These problems are addressed by talking to people once you have diabetes about medication as well as lifestyle management. Well, we all know prevention is the best medicine. So there is a condition called prediabetes, and prediabetes is also diagnosed by blood testing, but that's when we try to catch patients and talk to them about lifestyle management, how to eat smarter, lose 5 to 7% of their body weight, and get that 150 minutes of exercise or 30 minutes most days a week to try to make them healthier. Risk factors for having diabetes include having high blood pressure, being overweight, having a sedentary lifestyle. Also, family history is incredibly important, or having a history of gestational diabetes, which is diabetes during pregnancy. We want to prevent these people from having diabetes in the first place.
Hi, I'm Margaret Warner, Senior Healthy Living Director at the Lake County YMCA. I am also the program coordinator for the YMCA's Diabetes Prevention Program. The prediabetes rate in Lake County is 35%. That's a lot of people who are walking around pre-diabetic, and 10% of them don't even know it. Because the pre-diabetic rate is so high, we are trying to meet the needs in our community. So we worked hard to get into the program, be accepted by YUSA, and we are offering our first program right now. We have 8 participants who are ready and willing to make lifestyle changes. The class runs for 1 year, so it is more than just exercise and learning how to eat. It is a support group, and the group learns from each other. We have a lifestyle coach who has been trained by YUSA, and their job is to facilitate discussion, to lead people to make decisions that are right for them. There is power in the group, and we use that power to help people transform their lives.
We are so lucky to have the YMCA's Diabetes Prevention Program available to refer our patients to for support and information about prediabetes. And I am excited to be able to help my patients through the Y.